The following program is presented by Freedom Mini Dental Implants.
Hi, I'm Monica Hardin here with Dr. Regan Ackerman of Freedom Mini Dental Implants. And Dr. Ackerman, you are passionate about what you do. And my first question is, how do you even specialize? How do you decide to specialize on these mini dental implants?
That's a great question, yeah. So I was a general dentist. I've been a general dentist for about 16 years. Probably about the first 10 years of my dental career, I saw people struggling with dentures, lots of glue, they couldn't wear their denture at all, or I had to tell people, they needed all their teeth taken out, and I knew they were gonna have just regular dentures, and it was an awful, awful feeling. So when I discovered the mini dental implants, it was like a huge light bulb went off, and I was like, I have so many patients that would benefit from the mini dental implant and being able to wear their denture again, throw away the glue, or get rid of the denture completely.
That is incredible. And truly, you made a shift in your own practice as you were seeing your patients.
Yes, yeah. So I went to the American Dental Association meeting in Denver, Colorado, probably about 8 years ago, and I saw this course said, mini dental implants, and I was like, that's interesting. I want to know more about that. And I went to that course, and it was life-changing for me, because immediately I'm sitting in this hour-long lecture, and I'm like, I know exactly what patients that I can come home and offer this to and, help change their life. So within, the past 8 years, I've transitioned my practice to completely just doing mini dental implants. So that's all I do every day now is the mini dental implants. I probably each year I place about 1,000 of the mini dental implants.
This is your specialty.
So yes.
And I do want to emphasize that you are a locally owned, family operated business. And it's really, really great because when people come to your office for that consultation, they're seeing
They will see me, yes. I'm the only dentist there. Like you said, locally owned. We're a small operation, so we're not corporate. You're not a number at our office. Definitely, majority of our patients become family to us. We know who they are. It's kind of like the show Cheers. We know who you are when you come in.
Everybody knows your name.
Yeah, exactly. We know who you are. My husband works with me. He's my dental assistant, among many other things he does at the office. We only have, 3 employees, so it's a very small office. You're going to talk to the same people every time, and most importantly, I'm the only dentist you'll see.
Okay, and I want to touch on this because there's a lot of anxiety, a lot of trauma around dentistry, people's dental experiences, and a lot of shame when you're coming to situations where you might have teeth that are deteriorating. Talk to us about your approach.
Yeah, certainly. So, like you said, so many people are ashamed of their smile or their teeth, and they've done everything they can to try to save their teeth. A lot of people have been to the dentist multiple times. They've spent thousands of dollars on their teeth. They've tried, and they feel, guilty or ashamed. But we always say we're a judgment-free zone. So when people come in for the consultation, there is no judgment whatsoever. Everybody is in a different situation. Some people may have, not taken care of themselves because they were taking care of a loved one or had to put themselves on the back burner for a little bit. So, we hear all different stories, but definitely a judgment-free zone. The consultation is no charge. They come in.
Hold on, pause. Okay, so I know someone who was going through the consultation process. They actually had surgery, and every time they go, they were asked for more money for X-rays.
Yes.
And so that's, finances.
Right.
Affordability can be a barrier for people. Talk to us about why you make the consultation and the X-ray free.
100%. I want the information. I want to know that you're a candidate, that there's enough bone, which you don't have to have a lot of bone for the mini dental implant. It's a smaller diameter implant. But yeah, we do the 3D X-ray, which is known as a cone beam X-ray. A lot of dentists charge $300-$500 for it. It is no charge for us at the consultation appointment because I want to know. I want to have all the information and know that I'm giving you the best treatment plan and the best options that there are. So 100%, no cost for that treatment plan and the consultation.
Hello, I'm Gail Blair. A while back, my original dentist had told me that I was not a candidate for traditional implants because of the bone loss I had. And I started researching a little bit, and I found the mini dental implants that she offers, and decided that was an option that I wanted to explore to see if I was a candidate, and indeed I was.
My dentures were horrible. These Snap In Dentures truly make a difference. Really was painless. I really felt comfortable, and you know, I am so satisfied. I am so satisfied. I found Dr. Ackerman, and Dr. Ackerman, she really saved my life. She really did. She gave me my smile back. They were so nice to me. They worked with me and gave me exactly what I wanted, and yes, it's awesome.
It's a complicated, you know, when it comes to people's dental health, it's complicated for them.
Yes.
But it seems like you really simplify everything
That
for
is
people.
the point of the mini dental implant. It's a less invasive, simplifying the implant process. So it's, you know,
Talk to us
not
about that less
surgical.
invasive. Yeah.
Yes, yeah. So actually, I'll show this model because I think it speaks volumes for how less invasive the mini dental implant is. So, like I said, I don't need a whole lot of bone. This small little hole right here.
Right there, that's it.
It's kind of hard to see sometimes.
Wow.
That is the little hole I need to place a mini dental implant, okay? Versus the more traditional implant, they need a lot more bone, a lot more healing time. This is usually a lot more expensive as well than the mini dental implant. With the mini dental implant, I'm not making any incisions or stitches. I'm just numbing people up with local anesthetic. They can drive themselves to the office, place an implant, you know, even a single tooth, drive themselves home. So no sedation, it's that less invasive. But yeah, so, and then with the surgical implant, a lot of times they're making an incision, flapping open your gum.
I mean, this can take years.
Yeah, placing
to
the
repair.
implant, it has to heal another 3 to 6 months. Then you're going back to the surgeon, then back to your dentist. It's a lot of visits. A lot different with the mini dental implant, a lot less appointments and a lot less invasive.
I went in with a lot of anticipation, a little nerves, but I was so ready to get it done. And it was very simple. I mean, I didn't have any pain. There was some discomfort for a day or two afterwards, but it was minimal. And the actual procedure itself wasn't bad at all. It was very, it just wasn't traumatic, it wasn't painful, it was just, went really well.
You have an athletic background, so you understand the importance of, you played soccer.
Yes, yes.
And so talk to us about how that plays into your practice even today.
Yeah, certainly. So I grew up in Bowling Green, Kentucky, you know, just down the street, and I went to University of Florida on a soccer scholarship. So I'll say a lot of that, you know, my soccer background and athletics, I'm, you know, a competitive person. I always want to know what's better, what's best, always looking for the best thing possible. And when I was at University of Florida, you know, I knew soccer wasn't going to be my lifetime career.
Yeah.
So I started shadowing at the University of Florida at the dental school there. And that was probably one of the first life-changing moment for me becoming a dentist. The student I was shadowing at the time was delivering a denture that day to a lady that had no teeth, hadn't been wearing anything for years. They gave her her denture and just tears of joy ran, you know, down her face. And that's kind of when it clicked with me. It's like, you're helping people. This is what I want to do with my life.
Yeah.
So I came back to Kentucky and went to University of Kentucky for dental school. Told myself I missed the seasons in the Southern hospitality.
I love it.
So I did dental school at University of Kentucky. Then went out and, you know, general dental practice and then discovered the mini dental implants. And here I am.
Yes.
You know.
And can you show us these models here? You know, people, if they're wondering, okay, what does this look like compared to a traditional denture?
100%. So kind of one of the most common things I do is what we call Snap In Denture. Okay. So first of all, let me talk about a regular denture, especially the lower one. It moves and it flops, and a lot of people don't even wear it. They keep it in their pocket, or they take it out at their restaurant when they have to eat.
Can't you lose those, though? People lose them and throw them away.
They wrap them up in a napkin, and it gets thrown away. So nobody likes regular dentures. So with the Snap In Denture, we are able to keep the denture in and not have to use denture glue. So, you know, imagine this is someone's mouth without their teeth. These are the mini dental implants. So they're just a smaller diameter implant. When I place these, like I said, I'm just numbing up, local anesthetic. A lot of people know it as Novocaine. drive yourself to the office, drive yourself home.
So you're not even needing laughing gas or anything?
No,
okay.
Minimally invasive,
Nice.
okay? So many patients have commented, oh, that was so much easier than extraction, so much easier than a root canal, so much easier than a filling, okay? So it's not that high-pitched drill or anything like that. So I placed the, make that little pilot hole I was showing you earlier, and then this is a one-piece titanium screw that just screws and torques into the bone. So it's titanium, just as strong as the bigger implants. And the great thing about the mini implant, this does not have to heal another 6 months before we have to use it.
No.
Yes.
Wait.
Yeah, so not a year-long process, okay?
Get out.
The day I place these implants, I will put these attachments inside their denture, and they will leave that day with the denture snapped onto the implants. No more glue, no more floppy denture. You can eat whatever you want to eat with this denture. They'll wear it 24/7, take it out once a day or whenever they need, rinse and clean it, snap it right back in. Now, another great thing about the Snap In Denture, so let me show you this first, because a lot of people don't realize, first of all, everyone out there probably knows a family member that maybe has a denture, but they don't know, because a lot of people suffer in silence. And that's why they won't go to that family dinner, or they don't want to go out in public. And a lot of people are suffering in silence because they are trying to wear a regular denture. This is the regular denture, like for the upper, and you can see how bulky that is and how it, covers the roof of your mouth and may gag you.
A host of issues with that.
Yeah, so it can gag you, you lose all the taste. So with the Snap In Denture, whenever I place those implants, then I can trim some of that off the roof of the mouth and trim it back so it doesn't gag anymore, and you get some taste back. So
what's that like when you talk to patients?
For people, yes.
It really is. So this is
Yes.
not just an aesthetic change.
No, function as well, 100%. Yeah, a lot of people may, not even wear their upper denture anymore because it gags them so much. I've had a lot of patients like that, and we do the Snap In Denture, and then they're able to wear their denture again. So that's definitely, one of the more common procedures we do. But we also do several other things. We do permanent teeth. We do single teeth. There's so many ways.
So if you've lost a tooth in an athletic situation or in an accident, you can also
Yes, it doesn't
fix
have to
that.
be the whole mouth or all the upper teeth. Just if you're missing one tooth in the front or maybe missing a back tooth.
And how does that work?
Yeah. So like you said, some people are born without a permanent tooth in the front.
Wow.
That's, so they have a flipper or a partial. Very cumbersome. If people have it, they know what it is because they hate it. So the mini dental implant, so it's gonna place the implant the same way, just a little numbing, no incisions, no stitches. The day I put the implant in, if they're missing a front tooth, they will leave with a tooth that day, a temporary tooth. So they get rid of the temporary and the partial that day, okay? But the other nice thing is they don't have to wait, like I said, another 3 to 6 months to get their final tooth. They'll come back about 4 weeks later. We'll have the nice, pretty final tooth, and that will get cemented on permanently onto that implant, so it doesn't come in and out. I actually had a patient tell me, she's like, I feel like I grew my tooth back. So yeah, I thought that was great. And same thing, it doesn't have to just be one tooth. A lot of people are missing teeth in the back, and they can't chew as well. And so when we do that, we'll place multiple implants. And then we make a bridge of teeth. We always splint it together just to add strength.
Okay.
Then that gets cemented on as well, and it doesn't come in and out. And then you can chew that steak again or that salad, and you don't have to have a big bulky partial in your mouth anymore.
Okay. So you're talking about everything from how you look and how you feel, right? Which involves your emotional health, but also your nutrition.
Yes, yeah, it's 100% mental and physical improvement when you can get implants.
If you've ever considered it, then I would highly encourage you to go see Dr. Ackerman. I think you will be more than pleased. She does a wonderful job. I would not hesitate to recommend her to anyone, family, friends, anyone. She's wonderful. The office staff is great, and I wouldn't hesitate. If you're thinking about it, then I would do it, and I would do it soon.
Well, when I first started, I'd already had my dentures from prior, so I didn't have any teeth to have removed. So basically it was determining whether or not I had enough bone structure to support the system that was going to be installed. And of course I did, and you know, from then on I felt very confident that this was definitely going to be the right move for me to make. My life before the dental implants, there were times where I wouldn't even wear my denture because I'd kind of given up on wearing it because I was just so uncomfortable the way it felt, the way it looked, and everything. So there for a while, I just let my beard grow out to kind of cover it all up. And man, when the COVID mask mandate was in effect, I mean, that was like a free pass just to not have to wear the denture. But now it's a no-brainer. You want to put them in every day. You want to be smiling. You want to be seen in them. I've been dealing with tooth pain for a long time, so I know what it's like. And there's a lot of people out there that are dealing with bad tooth pain. And you know, you spend a lot of money and you try to save the teeth because you think that, you know, that's the ultimate goal, is everybody wants to have their original teeth and keep them in the best shape. But sometimes it's not always possible. Sometimes you got to consider the other options, and this is definitely a viable and resourceful option. You got to do it for yourself. You'll be sitting there up all night. You're going to lose sleep. You're going to be stressed out. Toothache pain is no joke. So getting it taken care of gets you back into a healthier lifestyle.
Uncomfortable dentures or missing teeth can make life miserable. Freedom Mini Dental Implants are a better way to replace your missing teeth. Get rid of that messy denture glue and snap in your dentures tight so they don't slide around. Or you can get rid of your dentures altogether and replace them with new permanent teeth. Freedom Mini Dental Implants are a lot less invasive and are a lot more affordable than the traditional surgical implants. Call for your free consultation today. See our smiley clients' 5-star testimonials at freedomimplants.com. Let Freedom Mini Dental Implants give you your smile back. Call today.
Tell me about one of your favorite patients. What kind of, I know you have to have all the stories.
I have a lot of favorite patients. That's hard. One of my, because I know a lot of people ask how old, you know, ages.
Yes.
One of my favorite patients was probably the 96-year-old man.
What?
Yes,
Oh.
yes. So any age, okay?
Yeah.
You know, I've done 18-year-olds, but the 96, he had a denture, and he wanted to taste his food again, and he hated dealing with this denture. And of course, at 96, one of the things he had left to do was eat.
Yes.
And he's like, I don't want this denture anymore. So we were actually able to place multiple mini dental implants and do the permanent teeth for him, where he had a bridge cemented on. It looked just like this, actually. So I just placed more implants, okay, minimally invasive. He actually drove himself, 96-year-old, drove himself to the office, and then we numbed him up, placed the implants, and he drove himself home. But then we were able to do this bridge for him, and this gets cemented on permanently, so it doesn't come in and out.
Okay.
We call it your third set of teeth. So you get your baby teeth,
yes.
right? You get your permanent teeth, and then, you know, for whatever reason, you lose your
Dr.
adult
Ackerman
teeth. You get your third set of teeth, your Dr. Ackerman teeth. And with this option, obviously, then you have nothing on the roof of your mouth. No denture. You get to taste all your food. And as far as home care goes, you're going to brush it, toothpaste, toothbrush, just like regular teeth. We give you a water pick, like a power washer, to keep it clean. Use that daily, and then you get it cleaned every 6 months, just like regular teeth.
Just like your regular teeth.
Just like regular teeth, yes. So this is definitely a nice option, is the permanent teeth. And I think it speaks volumes when you put the two next to each other, you know, a denture versus a bridge. Like everyone would much rather have this in their mouth.
Less is more, right?
Yes, 100%.
Someone who's watching, if they say, okay, I went to someone and I couldn't afford to do this, what's your message to them?
Yeah, so the mini dental implant, that's another great thing, is, you know, we see treatment plans all over the board. I mean, we have, and I'm not, I mean, people have come in surgical, like a $60,000 treatment plan, okay? So, but usually the mini dental implant can be about a third or half that cost, you know, for a single tooth, same thing. Sometimes it can be $6,000, $7,000 for a single tooth. And usually the mini dental implant can be about a third or half that cost. So, you know, it's hard to do specifics because everybody's situation is different. And that's certainly where the free consultation comes in.
Yes.
It's, you know, no charge to come in. So I always say, just, it's worth coming in and let me take a look and see what your options are and tell you what your cost is, and people may be surprised and it may be affordable for them. And we also do offer financing plans if they need to look at that as well and have a monthly payment plan.
And how have you seen these dental implants, the mini implants, change people's lives? Because you're saying, you know, some people who wouldn't go to family dinners or were afraid, you know, they couldn't function fully normally.
Yes, definitely. You know, a lot of people are like, oh, I'm going to that wedding now, or I'm going to that Christmas gathering, or my favorite restaurant I can go out to eat now, or, you know, my supper club, and I'm not embarrassed anymore. Or in pictures, one I heard this week was, I always turn this way in pictures so they don't see the gap, and I don't want to worry about that anymore. So we're able to definitely change the way people, you know, mentally, physically, and socially can interact again.
What do you say to the person that's out there and they're saying,
yes.
they know they want to call?
Yeah, and I know a lot of people are nervous or have anxiety, or like you said, they've been shamed before, or they've been to other dentists, got other, you know, treatment plans that either weren't affordable for them, or too much time, or were told they weren't a candidate for mini dental implants, or maybe they were told, a lot of people are told they have periodontal disease, which is essentially bone loss around your teeth. And so people think, oh, well, I'm never going to have enough bone to be able to do implants.
Right.
I've treated so many people that, you know, unfortunately lost their teeth because of periodontal disease, but they still had enough bone for me to be able to place the mini dental implants and give them a better option.
See, this is where, I love it. You were this athlete, you know, in sports, and you're determined, right?
Yes.
So you know there are options, and you have found solutions.
It's a great way to put it. I feel like I'm not going to give up on anybody. I really want everybody to have an option.
Okay,
so,
this is so good. All right, so we know we have the choices, and again, for the people who are like, okay, I'm going to call, they're courageous now, I'm going to call, walk us through the process of making that consultation call and what happens when we come to the consultation.
Yeah, so like we said, we're a small office, so you're usually going to talk to the same two people that answer the phone all the time, so they're going to know you whenever you walk in the door. The first thing you're going to do is my lovely husband and assistant will take that 3D X-ray, once again, no charge, okay? And then I will come in and I'm going to ask you, you know, what are you looking to accomplish? You know, what do you want? You know, what have you been going through?
And you're empowering them too.
Yeah.
Let's talk about that. People are afraid when it comes to dentures or mini dental implants. They don't want to have like teeth that don't look, they want to recognize themselves.
Yes, yeah, and the patient is involved in this as well. So if we're making dentures for them or making a bridge, they're gonna help pick out the color, the shade, the shape, the size. I'm not just gonna
tell them what they get.
Yeah, exactly. They have choices too, and we're in this together. I always say when patients start treatment with me, I say we're kind of married at this point. Like, we're in this together, and I want you to be happy as much as I want to be happy with your treatment and the treatment I deliver.
Now I'm able to wear my denture all the time. I can wear it when I sleep, I can wear it when I'm awake, all day. I take it out to clean it, put it right back in, or I could take it out for the night and even sleep without the denture in. Favorite foods that I couldn't eat before that I can eat now are like trail mix and granola and crunchy, sweet and savory snacks. And before, you couldn't eat that with just a regular denture. You would instantly regret it if you even bit into a Dorito or a tortilla chip. So having that has been changing. I get to eat the foods that I actually want to eat, not just the foods that I can eat.
I could smile again, and I'm not embarrassed to smile anymore.
Uncomfortable dentures or missing teeth can make life miserable. Freedom Mini Dental Implants are a better way to replace your missing teeth. Get rid of that messy denture glue and snap in your dentures tight so they don't slide around. Or you can get rid of your dentures altogether and replace them with new permanent teeth. Freedom Mini Dental Implants are a lot less invasive and are a lot more affordable than the traditional surgical implants. Call for your free consultation today. See our smiling clients' 5-star testimonials at freedomimplants.com. Let Freedom Mini Dental Implants give you your smile back. Call today.
My story is that I kept losing teeth, and they kept putting them on plates or some sort of, filling my mouth with the teeth that I had lost. And I had a couple of crowns, and then they started failing, and it was just to the point where I was embarrassed. I was very self-conscious. And when I heard about Dr. Ackerman and what she could do for me, I went to her and she looked at me and gave me all sorts of wonderful, exciting, procedures that could be done, and told me the plan. And I followed it. And I'm very, very happy because she replied, I have permanent uppers and lowers, and I have more confidence. I'm healthier. I would tell them not to wait. I waited too long, and it was just absolutely the best thing that I could have ever done for me. And I would advise anybody to do it if they have the problems. In fact, I have. I've told a lot of people that it's just, don't wait, just do it now.
This is the practice that you've decided to do.
Yes.
And how important is it just to reassure people that, when do they come see you again once they get the implants? Do they need to come see you again on a regular basis?
So that's a great question. A lot of, like with the Snap In Denture, once we've placed the implants that day and they leave with the denture snapped in, we always do one follow-up appointment, if they need any adjustments or anything. But then we always say that's their graduation day. Ooh. Yes. So basically from there on out, they're going to call me if they need a denture adjustment. If they have any issues with an implant. I think another great thing I forgot to mention is that we honor a 5-year warranty. If anything happens in that first 5 years, I will take care of it at no charge. Okay, because I want them to be happy. But really, after that Snap In Denture, if they need anything, they'll come back to me, but they'll do their home care. Same thing with the permanent teeth and the single implants. They're going to get their teeth cleaned every 6 months. Any dentist can clean those, because I see a lot of patients. I see patients in Indiana. I see patients from E-Town.
Wow.
I've seen patients from Tennessee, believe it or not. So a lot of people come searching, for the mini dental implants. So, but a lot of times, once they graduate from us, it's really only if they need anything. And I've had lots of patients that have had their mini dental implants for 10, 15 plus years.
Wow.
And doing fabulous.
This is so fantastic. You're giving people hope, you're changing lives. So your goal is not to have to see people over and over again.
That is the goal, exactly. That everything, they're good, they like everything. They're only seeing me if they have any issues, which is rare.
So once they graduate, you really don't want to see them again.
Yeah, we always say, I love you, but I hope we don't have to see each other again.
So fantastic. Is there anything else you can think of that we want to add?
I think we've hit a lot of the free consultation, so that certainly doesn't hurt to make the appointment. A lot of people have been wearing dentures maybe for 10, 15 plus years. So they didn't know this option maybe existed for them. And a lot of people are like, oh, well, I've worn dentures so long, I probably don't have enough bone. You'd be surprised. I've helped a lot of people that have had dentures for about 10, 15, 20 years, and I'm able to place the mini dental implants and put them in a better position.
I love it.
Well,
Freedom Mini Dental Implants. I love the fact that you're like, let's see. There's an option.
Yes.
I know you don't take no for an answer.
I try not to.
Oh, this is so fantastic. Well, thank you so much for the work you're doing.
Certainly.
And I want to talk more, but we're out of time now.
Okay, yes.
But thank you so much. And if you have questions for Dr. Ackerman, or if you want to make an appointment for that free consultation, give them a call and visit their homepage. I'm Monica Hardin. Thank you so much for being here with us.